Oh.
Okay, so we are live. Great.
Yes.
So welcome everybody to part 4 of our Welcoming Spaces discussion series. My name is Tanya. I'm the community developer here at Elevate. And with me today is our volunteer coordinator, Fred Young. Fred, I'll ask you to introduce yourself.
Hi, I'm Fred Young. I work at Elevate NWO as the volunteer coordinator. I've been with Elevate for close to 12 years, I believe now. Yeah, and I'm a gay HIV positive man.
Great. Thanks, Fred. So today we are going to be talking about what it means to create a welcoming space and what welcoming spaces can look like and feel like for people living with HIV. So far, up to this point, we have learned about some basic facts around HIV. We've learned about HIV stigma, what stigma is, how it shows up in our institutions, in our social interactions within ourselves, and between communities. The series is called Welcoming Spaces, and I realize that we've taken to part 4 to actually start talking about welcoming spaces. We spent a lot of time talking about stigma, but it's really important as foundational information. It's really difficult to talk about how to create a welcoming space when we don't have the language or the knowledge about HIV transmission for one, and some of the HIV basics, as well as what is creating barriers for people. It's hard to remove the barriers if you don't know what the barriers are, if you can't see them. So we needed to spend that time to really take our time to think about those things and talk about those things and really parse them out. But now, yay, we can talk about what it means to create a welcoming space and what welcoming spaces really look like and feel like. We're going to be focusing on institutions, so on organizational spaces, workplaces, more than social spaces or private spaces today. Just because there's a lot to talk about there, and there's a lot of things that people can do, and it comes down to policy, procedure, practices, the attitudes and beliefs that are held by staff and frontline workers and volunteers, and all of the different people that someone coming into your organization or workplace is going to be interacting with, as well as fellow staff. So as a person, as if a staff person living with HIV is also going to need certain supports and workplace policies that support their needs as well. So we're going to be talking about what positive experiences look like. We'll probably also, as a consequence, also be talking a little bit about what some negative experiences have looked like. And yeah, we'll see where else we go. There is a post that went out on Tuesday that has a lot of really good questions that you can ask as an organization or as a business, as a workplace, that can help you sort of think through some of these questions, think through or work through where stigma might be hiding within your policies and practices. And I really recommend going to take a look at that list. If there are things there that you've seen that you have questions about, please let us know in the comments and we'll try to address them. But also know that we are here as an organization to support other organizations wishing to look at their policies and wishing to improve their service delivery for people living with HIV. We can do training around that and skills building and capacity building around that. So we are here beyond the confines of this virtual series. So I wanted to talk first about your experiences, Fred, and just wondering a bit about what it was like for you when you were first diagnosed with HIV.
I was diagnosed, I believe it was 2003, 2004. And the reason I found out was because I got very sick. I had pneumonia, and I went to see the doctor, and he put me on some strong antibiotics, and he said he wanted to do some blood tests. um, called me back, you know, a week later or whatever it was, and told me I was HIV positive. You know, being that sick, I knew something was wrong because I'd never been that sick. He said if I would have waited, I would have had to be hospitalized because it was pretty severe. Luckily, it was like I got medication, antibiotics, and recovered. But it was the shock. But living in Toronto at that time, uh, I certainly knew a lot of people who were HIV positive, and you know, some were um, dealing with it very well. I wasn't overly concerned, other than it's a shock, and it was sort of like, you know, some people talk about uh, how it's like a realization that you're going to die. So it's sort of, for me, it was like, well, what am I going to do with the rest of my life? Because you didn't know how long you've got to live. In reality, nobody does. So it's sort of that awakening of that consciousness of that I'm not going to live forever. You know, we think as teenagers, oh, we've got all the time in the world or whatever. But when something like that happens, it's a sort of a walking into a brick wall. It's like, oh, it's there. I've got to deal with it.
Yeah.
So um, after the initial shock, which for me, I think was maybe a couple weeks, I just sort of got on with my life. I was lucky. I lived in a center like Toronto where there's lots of people, there's a thriving gay community, and there were resources. I can't imagine growing up here, like if it happened here at that time, what kind of resources I would have had. I didn't know at the time AIDS of Thunder Bay existed, but I'm sure if I'd seen a doctor here, they might have known about it. Not all doctors did, from experience that I've had working with other people who are HIV positive. But you know, I've just been very lucky that I was in a place where there was community, there were groups. Uh, if you were gay living there in downtown Toronto, where I lived, you knew at least of a few people who were HIV positive. And you certainly saw the ravages of it before the drugs got better.
Yeah.
So yeah, that's my background as far as my experience of learning I was positive.
Were you living in Toronto during the height of HIV in the 80s and 90s?
Yeah, I moved to Toronto, I think it was in like 85 or something like that. So by that point, it was in full force or whatever. Um, so you saw people who were, you know, had Kaposi's, Kaposi's, the cancer. You saw people like that. You saw people who aged like 20 years because of, you know, the AZT, a form of medication at the time before the 2000s.
Yeah.
I was lucky I had only a combination of 3 pills that I had to take, which before that, if you were on a cocktail, what's known as a cocktail, you had literally hundreds of pills to take.
Yeah. In I think the very first week of this session, we spoke to Renee, and he talked about having to take like 45 pills a day.
Yeah.
At the beginning.
Yeah. And that's when you think about that as somebody who isn't HIV positive, just think of taking, you know, that much in vitamins every day, having to take that much.
Yeah.
You know, people may take 2 or 3 vitamins, you know, but yeah, Yeah, it's unreal what the progress. We were lucky. I
Yes.
was very lucky to, when I became positive, that there was alternatives to that.
Yeah.
Because a lot of people got sick just on those pills, on
Yes.
top of their HIV.
The early pills were very toxic.
Yeah.
Yeah. So in terms of access, so at the time, I'm sorry, I missed the year in which you were diagnosed because I was switching over to Facebook to check out if there were any comments or what was going on there. But what year was it again?
2003 or 2004.
So at that time, were people getting recommended to start treatment immediately, or was it kind of like, oh well, we'll wait until your CD4 count goes down before we start your treatment?
Yeah, from what I remember, it was if you had a CD4 count of 500 or under, they put you on the meds. They didn't necessarily think at that time that it was a priority to be put on meds right away. Now they know it's best to go on the meds immediately after finding out your diagnosis.
Yes. Yeah. Yeah. Okay. So how long was it before you started taking medication?
Good question. I think it might have been almost a year. I think almost a year.
Okay. And so I'm assuming then that you started on medication because your immune system started to dip.
Decline. Yeah. Yeah, I believe that's what because I had a number of doctors at the time. Like I'd gone through a number of doctors because they were moving around the doctors. I think I had my general, but then I had at least three doctors, different doctors between say 2003 and 2006.
Okay. And in terms of access, like when you talk about living in the village and already having a bit of a community around of people who are living with HIV and kind of know what's what. But in terms of accessing services, supportive services for people living with HIV, or um, like financial supports for medications and things like that, how did you find accessing those types of services?
I found it difficult. I
Yeah.
found it difficult, even though there was PWA and different organization in existence. It was kind of difficult uh, because the drugs are so expensive. Pardon me. And the prices, as far as I can tell, the prices haven't gone down any. It's about 1,500 a uh, a month for meds. So it's really important with organizations like you're working in or your job that you have coverage for that, because that's a lot of money.
Yes.
And luckily I've had coverage, but accessing ODSP, because I've never done that before in order to get my meds, that was a bit of a challenge. And even within uh, I remember going to the doctor's office and saying, I don't know anything about ODSP. I have no clue. And being uh, sent to somebody who knew how to do the paperwork. But even then, it was sort of, they were overworked. So it wasn't easy getting the answers I needed. But
Yeah.
eventually I did. Um, and that certainly, just having to do all that, if you're stable in a job and things, that's not so bad. But if you're, say, marginalized in any way, or you're, homeless or on welfare, I can't imagine the stress level that would put somebody on. Like for me, it was stressful.
Yeah.
I can't imagine if I had other things, if I was marginalized in some way, how would you navigate that? How would you, with the levels of stress and fear, because that's most often, I think that's when somebody is diagnosed, that's, that's the first thing, is the fear of the unknown.
Yeah. Yeah. And I mean, this is why so much of the conversation now in the sector anyway, is we're talking about treatment and getting access to treatment, but also talking about equitable access to treatment, recognizing that it is so much easier for some people to access treatment. And as a consequence, we see much better health outcomes among, middle-class white gay men than we do among, Indigenous single women, for example, because of these disparities in access, in income, in support systems. If you have support, it's easy to get more, it seems. But if you don't have support, then it's hard to get up to the level where you have enough. Once you're there, you can get more, but when you don't have it, it's really, really hard to get.
Yes, and if you haven't had the luxury of growing up in relatively middle class conditions, where do you go?
Yeah.
It's hard enough to get on, say, OW or ODSP, or God help you if you're, on welfare. Because you don't necessarily know if those people know what you need.
Yes.
And how scared you might be to reveal that you're HIV positive, and the stigma you might face. That's a real fear that people do have.
Yes. Yeah. And in that way, HIV is, it's something that we deal with every day, and we have specialized services around this, but HIV really is everyone needs to be aware. It's everyone's issue, because people living with HIV don't just need one thing. There's all kinds of different supports that people will need, and all kinds of different services. And so we have to be able to provide supportive services and welcoming services, so that people will access those things. When you moved to
From Toronto.
My words all mixed up. Yes, you moved from Toronto to Thunder Bay. What changed, or what was different? Like, what differences did you see in terms of supports available or community available from Toronto to Thunder Bay?
I think the biggest thing was the isolation. In Toronto, you have millions of people. You have organizations. You have connections. Here, when I moved back, it was 2010, I think. So it'd been a number of years. And I was on ODSP for my drugs, so that was fine. I was still able to access my medication. But I did find out before I left Toronto if there was anything in Thunder Bay that I could access as far as support, which was at the time AIDS of Thunder Bay, which is now Elevate. So I was lucky I had access to that. Some people just move and they have no idea. But if I think that what I did was I looked up, well, they told me it was called AIDS of Thunder Bay. And then I just looked it up, and I talked to a counselor there, and it wasn't long after that I started volunteering at the agency.
Yeah.
So I was lucky. I had the connections.
Yeah.
People sometimes move to a city and have no clue. And if you don't have a basis, like I obviously had a basis of knowledge of HIV, if you don't have that, what are you going to do?
Yeah.
If you move from a small city to another small city, you don't necessarily know.
No.
So networking is really important for people when they do change cities or come from a small community.
Yeah.
So the information also has to be out there,
Right.
like brochures in doctors' offices, things like that, even billboards. I remember seeing a billboard here, Renee, I think it was Renee was on it. And I thought that's really cool because, somebody who might be diagnosed but doesn't want to tell anybody, it's right there. I'll call them, that sort of thing, even, being scared to go through the front door, or even to phone, that's a reality a lot of people face.
Yes.
That's why it's
Yeah.
important. That's why we stress at the agency a welcoming space.
Yeah. Yes, exactly. Because if you can't even build up the courage to phone us, then there's nowhere to go from there.
Yes.
And so when people do build up that courage, we need to be really welcoming. We need to be, put any judgments we have aside. We need to be able to work with openness and with love and with caring from the beginning.
Yeah. One of the phrases that has stuck with me through the years was service without judgment, which is super important.
Yeah.
If it wasn't for that, how would you be treated, right? Because you may not just have HIV, you may have other things that make you who you are. So
Yes.
service without judgment is extremely important to get people to a good space.
Yeah. I want to talk a little bit about, when we talk about, Elevate being a welcoming space, or spaces that you've been in that have felt really good. What is it about those spaces that has made you feel like, oh yeah, this is going to be a good interaction. This is going to be I feel safe here.
I think one of the things is it's important to have information up, like a poster, even. HIV, like we did at the office, we did HIV and Hep C. You can't get it through a hug or through a kiss, just very plain, open messages that it's a welcoming space certainly in regards to HIV.
Yeah. So we're talking about physical space right now, and like posters and messaging and having those things, and those are really easy things that people can do to create a more open space, and just to to signal visually that that people are welcome, and that you're not going to face judgment and discrimination here.
Right.
Yeah. So the toolkit that we've based this series on actually has, I'm just going to show it briefly. So this is the toolkit that we've based it on. It's a really great toolkit. It's got lots of good information in it. Outlines a lot of the stuff that we've been talking about, social stigma, and it's got some exercises and assessment tools as well. One of the things that it has that is about physical spaces, and sometimes we don't think so much about our physical spaces, but that's the first impression that people get when they walk in the door, and so we want that first impression to be as good as possible. Like sometimes I was thinking in preparation for this about two different experiences that I had going to get HIV testing, and one was a university sexual health clinic, and it was brightly lit, like not like overly, not horribly brightly lit, but it was well lit and very private and very comfortable, and had soft chairs and bowls of condoms around and lots of information and things like that, and friendly staff, and it was a really good experience. It made me feel very comfortable, and then I'm thinking about an experience that I had when I was living in South Africa at a public clinic, where it was like just rows and rows of chairs, hard wooden chairs, and everyone was sat together like this, you know, right beside each other. And there was an open desk where you had to go up and tell people what you wanted to do that day. And the HIV tests were done in an outbuilding behind the clinic, in the clinic compound, in a totally different space that was only for HIV testing. So you had to like walk out of the clinic into the compound, which was out in the open, into this special building that was only for HIV testing. And it was just like so nerve-wracking and you know, unpleasant and very exposed. And so, you know, the physical spaces that we provide for these types of things are super, super important.
Yeah, yeah, for sure. Certainly for somebody who's nervous, like, would you even go get tested in a circumstance like that?
Oh
Certainly
my God. I
in
never
North
went
America.
back there.
Yeah,
I never went back there again.
yeah, that's very scary.
Yeah.
It's almost like being in an interrogation with a
Yes.
crowd watching. You know,
Yes.
who wants that if they want to go get a test?
Yeah. And you already feel so exposed. You already feel like when you're going to access like STI testing or like HIV services, you feel exposed already. You feel like everybody can see why you're there. And so we really need to be very mindful of that people are already feeling like they've got everything, that they're wearing everything on their sleeve. So this poster is it's a really good guide. So it's massive. So I do have copies of this if people are interested in it, but it's also in the guide. But it talks about some points. So you can actually walk through your space and look at all these different areas.
That's very cool.
And think about, you know, what does your space look like? Does it provide some of these things? And this is geared specifically for women living with HIV. And making spaces welcoming for women. But really, you know, if you make your spaces welcoming for women, they're going to be welcoming for
Everyone. Yeah.
So, and when we say women, you know, I'm also including, you know, that's cis and trans women. You know, if we're making welcoming spaces for everybody, we're including everybody.
Correct. Yeah.
Yeah. So yeah, physical spaces. Pretty important as a first impression. Sorry, I think I interrupted you there, Fred.
Oh, no, it's okay.
Okay. I'm just checking the comments quickly. Okay, we're good. Just in talking a little bit about treatment, and just actually just because I was just on this webinar right now where they were talking about treatment and the evolution of HIV treatment, and it got me thinking about treatment fatigue. And I just wondered, Fred, if you had ever struggled with either accessing treatment or adhering to treatment, if you'd ever experienced treatment fatigue, and how you've been able to manage that.
Yeah, I'd be surprised if there was anybody that didn't have some form of treatment fatigue, or, you know, sometimes you forget you've taken your pills or whether or not you had taken them. So, you know, there's little things you can do, like having a pill case that has your pills in it. And if that's missing from there, well, you know that you've taken them. I've also used my alarm on my phone to alert me, oh, I've got to take my pills now. But it can be a challenge, especially if, you know, you're going through other things. COVID, for instance, you know, it's a stressful time. There's all sorts of things you have to remember to do: wash your hands, wear your mask, you know, take care of your body. Even for, you know, just a person who's healthy, it's difficult. So imagine if you had something else on top of that. So it's just a matter of trying to stick with it and know that the treatment is doing what it's supposed to. Knowing how your body is, you know, if you're feeling unwell, to, you know, seek medical a medical opinion? Is it, just, I was concerned because I'm aging. Are these aches and pains anything to do with my diagnosis, or is this just, old, a body just starting to age?
Right.
So you question a lot when you have, a diagnosis, a HIV diagnosis. And I imagine same thing with somebody who, would have another illness. They'll question whether or not it's part of their illness, or if it's just the aging process, or, something similar to that.
Yeah.
But that's what I recommend is if you do have a problem with remembering to take your pills, do a alarm on your phone. Almost everybody has a cell phone nowadays, so it's an easy thing to do. I forgot to take pills just the other day because I stopped using my alarm.
Right.
So that's something that I've got to get back into, is putting my alarm on for a specific time and take those pills at that time.
Yeah.
Well, it's one pill now for me, but
One pill. Yeah, that's great that you were able to,
yeah,
to get onto the
it's
one
a
pill.
monthly pill, but it's just one.
It's huge. I know they're huge. I think like that's part of it too, and people don't understand. Like when we say we're taking one pill a day, or even like 3 pills a day, it's not. They're not. It's like taking a giant vitamin C pill.
Yeah.
Multiple times a day, multiple pills. They're not. They're not just little. It's not like popping an Advil.
Yeah, I remember my father showing me his pills that he had to take, and and he had a hard time swallowing them. And I showed him mine. He goes, "Holy cow! There's no way I could swallow that."
Yeah. Yeah. It's big. They're big. In terms of your family, disclosing to your, I mean, I know that we're mainly focusing on organizations and those kinds of interactions, but I feel like I need to just touch on family as well. And how was that for you, disclosing to your family, and
It
how
was
did that
stressful.
happen? Yeah.
Well, I first told my eldest sister. I told her after I just before I moved back, I think it was. I visited Thunder Bay and I told her. And that was really stressful for me. I was really open about my HIV in Toronto, living in the gay village, and like everybody knew somebody. So it didn't affect me that way, but it was stressful having to deal with telling my family. But, one of the things, I didn't have to go into it with my parents. Really, all I did was say, yeah, I've got an immunodeficiency disorder. And I described what that entailed. And I said, I have to take pills in order to maintain my immune system. So that's the way I dealt with it. Some people are scared to take pills in front of people, but they don't necessarily know that's an HIV pill.
Yeah.
That's how I sort of, when I've talked to people about taking the meds, it could be a vitamin.
Yeah.
And you don't have to tell them what it's for. You can always say, oh, it's just a vitamin, or it's for, whatever. You don't have to disclose to anybody except your doctor that you're HIV positive, or if you're, getting surgery or, something like that. Those people need to know. Not everybody needs to know.
No. And yeah, and then again, like I think it's that exposure thing. It's like people are worried that everyone's going to know, because you feel like by pulling out this pill, everyone's automatically going to know why you're taking it. But people take pills all the time for lots of different reasons, and it could be anything.
Yeah.
Yeah.
And even going into an agency like our agency, I know there were people. I was an intake manager or intake person for the agency for a while, and I know that people were fearful of being spotted coming into the agency. So I said, well, if anybody asks you, you can always say you went into the wrong building, You came in to see about volunteering because you heard something about they were looking for volunteers. So there were ways to sort of navigate that with them. It's not, who's gonna, sure, somebody might see you go in and they might ask, but you don't have to tell them that you're HIV positive. It could be for another thing.
Anything. It could be, oh, I needed to use the bathroom. It was the closest bathroom.
Yeah, yeah. Or I thought it was a different
Yeah.
place, or I heard there was doctors' offices in there, or
Yes. Yeah.
there's all sorts of ways to sort of calm people and get them around to understand that you're not being watched. And I think that's a lot of the fear, is that somebody's going to find out.
Yes.
Certainly it was in the past. I'm not sure how, it's probably still prevalent, I would imagine.
Yeah. I also think it's really interesting the way that you framed it with your dad or with your parents, that, oh, it's an immune disorder and I have to take pills. It's like when you take away the word HIV, then that takes away all of the scariness somehow, because now
Yeah.
it's just a chronic medical condition, which is what it is. It is just a chronic medical condition. But when we attach these words to it, then all of a sudden it's a huge scary thing.
Yes.
So I think it's really interesting that you were able to just take the words out and it was fine.
Yeah, and I that's what really worked for me, was because there's all sorts of immune deficiencies, right, or disorders, or so for me to frame it in that was much more freeing, but still being honest.
Yeah.
Without the stigma.
Yeah.
And without the questions.
Right.
Because as soon as you say HIV, they may not exactly know. That generation, they might know it as AIDS, which it isn't. So you have to sort of shear off the stigmatizing language.
Yeah.
In order for them to understand, maybe. And that's how I was able to deal with that. Yeah.
I think that there's one other thing that you talked about, and we talked about this too in our conversations leading up to today, but just talking about having someone, like having community, and how important that was in Toronto, when you had other people who you could talk to who were going through similar things, who had been dealing with this for a long time. And then, in contrast, the isolation of having no one when you moved up to Thunder Bay. So just wondering if you can talk about the importance of representation among people who are living with HIV, the importance of, we call it GPA and MIPA, so the greater involvement of people living with HIV and meaningful engagement of people living with HIV. How important is that?
I think it's probably one of the most important things in order to grow beyond your diagnosis. Right now, we're not able to do groups or meetings in the office. But at the beginning, having a group of people who are all HIV positive and to share their experiences is really, really helpful, because you're not alone. There are other people who, and at varying degrees in their diagnosis. It was nice to be able to, I remember being in a group in Toronto where there were people who were diagnosed like years before me, having to hear what they went through and what their conditions and what their knowledge was important to have that I'm not alone syndrome. You're not, no one's alone in this. There are other people with it, and it's really helpful to, whether it's HIV or anything, if you're going through something like, cancer, cancer survivors, groups it's a huge thing. Community is a huge thing. Knowing you're not alone is a huge thing. I always recommend if somebody is positive to go to a group. You know, just try it out. You'll meet other people. You'll get support. And that's a big thing, getting the support and knowing that you're not alone.
Yeah.
And learning
being
from
able
other
to-
people's
Yeah.
experience.
Yeah. Yeah. Yeah, exactly. Because, you know, as much as people who are not living with HIV can be super supportive and knowledgeable, it's not the same.
Yeah. Yeah.
Yeah.
It's like, you know, there's groups for people who've lost someone, a grieving group. You don't know that if you haven't gone through it, you really don't have any firsthand experience. So you can't really speak to it on a real practical level.
Yeah.
Whereas if you go to a group of like-minded people,
Mhm.
or people who have experienced it, it makes a huge difference in someone's life.
Yeah. The webinar that I was on just before this that was talking about HIV treatment, there was a group of 4 people from various backgrounds, all living with HIV, who talked about their you know, their treatment journey or various aspects of treatment. And one of the people right at the beginning said, I'm always so happy to be here with, you know, to be with other people living with HIV. There's a special kind of magic that happens when people living with HIV get together. And you could see it on all of the other people's faces, even though they weren't together in the same room. It was just like there was a freedom that they felt.
Shared experience goes a long way to help, you know, feel and realize what is going on.
Yeah. Well, it is 2:45. Can you believe we've talked for 45 minutes?
No, it feels like 5.
I know. I want to thank you so much for joining me today, Fred. It's been really,
Well, thank
really
you
good.
for having me on. Thank you.
Do you have any, I don't want to cut you off if you have any last words. If you don't, that's okay.
Just like to say, you know, if there's somebody who's HIV positive and is watching this and has felt alone, reach out. We're there. You'll get an ear.
You sure will. All right. Thank you. And again, to anyone who's tuning in, who works for an organization or has a workplace that, you know, you want some support in talking these things through. I hope that this conversation, although we didn't talk, you know, we didn't go into like, how do you develop policy? But I hope that this conversation was really helpful in framing why it's so important to have a welcoming space, and like what welcoming spaces can look like and what positive interactions can look like and what that means, and just the importance of coming from a place of openness, and non-judgment, or, you know, putting your judgments to the side, to really work with people and support their needs. I hope that you'll join us next week. Next week is the conclusion of the series. Renee is going to be back, and we'll be talking about everyday actions that individuals can take to reduce stigma in, you know, on a day-to-day level, in their lives and with their loved ones and with friends and all over the place. So I hope you'll tune in for that one, and have a great rest of the week. Take care.